the 10 salient points of this POCSO Act. Briefly, I just want to touch upon it. First is burden of proof is on the accused. That means once the complaint regarding the POCSO victim is lodged, now it is the responsibility of the victim to prove, it is the responsibility of the accused to prove the innocence. And it is not the responsibility of the child to prove the crime. So that is one. Secondly is the calibration of offenses. Dr. Pancham has elaborated the offenses which are included in the POCSO Act is penetrative and non-penetrative. Penetrative, we are all aware. Non-penetrative, even the stalking a child or abusing, beating, that also is covered under POCSO Act. Next is the severe punishment is there if the offender is the government employee. Then introduction of the child-friendly measures. Now, once the complaint has been lodged and there is a minor girl or a boy as a victim, so now entire focus is to provide the situation which is comfortable to the child. So usually the child is not brought to the police station. The police people, preferably the women and in the civil uniform and not in the police uniform, they are supposed to come and record the statement in a friendly environment. Then next is the support person. Now, as soon as the victim comes, minor assaulted victim come to any hospital, so we immediately call the police. And it is our police usually informs the child welfare committee. It is their responsibility. But as a doctor, we have to see that the child welfare committee has been informed. So they provide the support person, that is IO. So that person remains with the family, with the child throughout the proceedings. They accompany the child to the court also and accompany to the hospital or anywhere, whatever is required, so that nothing more happens to the child. The child remains protected. And it is everybody, every citizen of India is responsible that whenever we see, we hear or we see any kind of offense, that is penetrative, non-penetrative, even in your neighbor or you hear about it, it is our duty to inform to the police that such and such crime is happening. So we can inform to the police directly, or there are special juvenile police units are there, or the helpline number, but we have to inform. And if we fail to inform and if it is discovered later, then we are even liable for punishment for 6 months. So that we have to keep in mind. And next is there is no discretionary jurisdiction. That means anywhere the complaint can be lodged and the proceedings will happen. Confidentiality has to be maintained. The media is usually refrained from all these proceedings, especially the child name and the family and the photo. It is strictly prohibited from the media until unless some information is, it is thought that you get additional information by disclosing the identity or anything, then it is given. Otherwise, it is strictly prohibited. It is a crime. Now it is a speedy procedure. That means whenever a complaint is lodged, it is a responsibility of the police to gather all the evidences and everything within the period of 30 days, within the period of 1 month. And the court is supposed to give the order within 1 year. Otherwise, the actions will be taken against it. Because earlier the cases used to go on and no remedy was given to the child and the family. So now it has come with the strict rules. So, but another thing we have to see that making a complaint or providing information with the intention to humiliate or extort or threaten or defame any person, it is punishable. But if a child complains regarding that such and such person has committed a crime, and even if the child has just said like that, the child is forbidden from any kind of punishment. But yes, if any adult says false statement regarding POCSO crime has been committed and it has been proved it was no, so that also person is supposed to be liable for punishment. So that we have to keep in mind. We cannot defame any person in the thinking that it is a POCSO act. So now, as a gynecologist, now we have to understand, actually the POCSO Act, it is very vast and it go on and on. But for a gynecologist obstetrician point of view, I have just summarized so that in our day-to-day practice, the things are very clear. We have to understand one thing very clearly, that any girl who is less than 18 years, if she has done a sexual intercourse even with the boyfriend, that means with a consent, or without consent, if she is raped, it is considered as a sexual assault and it comes under POCSO Act. And as our doctors, it is our duty to inform to the National Commission for Protection of Child Rights in a form of MLC. And our duty stops once we make the MLC and once we do the needful. We don't have to go through the procedure of court proceedings or till the end the child gets the relief. So that we have to keep in mind, because people think, oh, the POCSO Act, POCSO victim has come, now we have to accompany each and everything until 1 year, till the remedy is sought. No, as a doctor, we just have to make the MLC. I will be going into the detail in the next few slides. We have to make the MLC, use the safe kit. If it is required or not required, inform the police. And then we, of course, about the delivery or the abortion, things we have to do. And then it is over from our part. We don't have to accompany the legal aspect or court proceedings or anything like that. I hope I am clear with this. So as a obstetrician gynecologist, we will encounter 2 scenarios associated with the POCSO Act. I am not going to talk about touching, pornography or all those things. That is clear. Once we hear it or see it or we find it, we have to inform to the police. That is different. Now I am talking about the 2 scenarios. Once a victim comes with a sexual assault, girl who is less than 18 years comes with a sexual assault. Either it was a consensual with a boyfriend, or she is married, or it is a non-consensual, which is a rape. And second scenario, less than 18 years girl comes with pregnancy because of sexual assault, consensual or non-consensual. So these are the 2 scenarios. Now, as soon as the patient comes, now let me make it very clear. There are the doctors who are from the private practice also, and doctors from the government institution also. So let me talk about the private doctors first, who are having the clinic or the nursing home. See, whenever such case come, less than 18 years girl, if they come to your clinic and they want MTP or abortions and they ask for it, or any girl who is brought by someone that they had the intercourse and she is less than 18 years. Even if you don't have facilities or you don't want to indulge into such cases, you don't want to do the MTP or nothing, it's fine. But you have to inform to the police, okay? Whatever information you have, the name of the patient, age or address, whatever little bit they have disclosed to you, you inform the police, okay? How you inform the police? If in nearby your hospital or a nursing home, if you have the police chowki, you call them, you inform them. If you don't have, if your clinic is far away and such patient comes, you can email also your nearest police station, or you can make a telephone also, 100 number that is recorded also. And best is to your OPD slip, okay? You call the police and let them come and let them sign and take the receiving also that you have informed to such and such people. See, nowadays phone calls or emails are also taken into consideration, but I never suggest this. I always suggest to keep a receiving signature on your OPD paper, the patient file or whatever, so that after few years, suppose the case happens and if you are called also, you have the proof. But after 2 years, 3 years, when you are called, you don't have the proof if you have done the telephone, although it is recorded, but the exercise becomes very cumbersome to retrieve the recorded message, to retrieve the email, all these things. So, but whatever way you inform, you have to keep the copy of it, recording of it, because you may be called, you don't know, after 2 years, 3 years or whatever. Okay, so that is one thing. And then you can refer the patient to the government hospital. That is the best for this thing, but you have to inform. Okay, so now once you inform the police, either the private practitioner or the government hospital, like in our tertiary care also. So police, they inform the child welfare committee. Now child welfare committee in the district also, there are 10, 11 child welfare committees. So whichever committee is nearest to your area in the district, the police informs it. But you have to ensure that the child welfare committee has been informed. So there were the cases in our GTV also, like 1 or 2 child welfare committee was not informed. We informed the police, but they did not inform the child welfare committee. So we were asked the explanation for it. So now what we have made the policy that we inform the police and we ensure that CWC is informed, and we rather write an email also to child welfare committee from the department, gynae department, so that they are informed, and this has to be done within 24 hours. Now, what is the role of Child Welfare Committee? Basically, they will assess the child and they provide a support person. I have told you, that is IU, investigating officer. So that officer name and number they provide. So you can call that person as and when it is needed. And that person also accompanies the child for the legal advocate work or the court work, or if the child requires further medical care, anything. So the support person is there. So that is one thing. Now, coming to the medical examination. Now, medical, this using the SAFE kit, that is a sexual assault forensic examination kit. Now, this kit has to be opened if a sexual assault victim comes to you. Okay, not for the pregnancy. If they come with the pregnancy, that the scenario is different. Now, this kit has to be used if they come with sexual assault, consensual or non-consensual. Now, earlier, this kit was supposed to be used within 4 days of the assault, but now new guidelines, they say if the victim comes up to 3 weeks also, then also you are supposed to use the SAFE kit. So we will be going into that detail. So now, as a obstetrician, now what is our duty? Now, see, whenever any patient comes and she is in a critical state or she has injuries or anything, so you have to attend to all those first aid you have to give. Even if your hospital is certified, not certified, you have any, you don't have to ask for the legal paper also. Like earlier, it was the thing you have to ask the court legal paper from anywhere, from the police or anything, but no. Today's scenario, any sexual assault victim comes in the critical conditions or injuries, you have to give the first aid to that patient. You don't have to ask for any kind of legal work. It goes side by side. So you have to give that. And whatever means you have in your clinic or hospital, with whatever way you can do the first aid, you do the needful, and then you can refer the patient. But yes, inform the police, make the MLC. That is very important. So you have to take, take the detailed history. Okay, just started 1 minute. I'll use it. So you have to take the detailed history, and then prophylaxis also you have to give, HIV prophylaxis if it is required. Then STI test also is done, and hepatitis test is supposed to be done. Then HIV, all viral markers we do, and CBC, urine pregnancy test, everything is done. Examination, everything is done. You don't have to do the per-vaginal examination. But if you feel that the patient is bleeding or you suspect something, you do the examination under anesthesia. Okay, don't do the PV or PS examination, nothing. This is for the minor patients. Okay, and then side by side, everything goes. And then, consent is very important. See, there are two different things. Consent for MTP, that is different, and consent for examination. Now, a girl who is more than 12 years can give the consent for examination. Okay, so they can deny also, but then you have to explain to them that this is important part. So usually they agree, and you take all the samples. What all samples I'll be talking this thing. And age is very important. Aadhaar card is not taken into consideration. Usually if they have a birth certificate or if they have a school certificate, fair enough. But again, if you have a doubt about it, then we ask for the medical board. So then they assess everything. Medical board means forensic board that is called upon to do the age estimation. So they take into consideration all the radiological examination, dental and everything. Then they give the date of the patient. That is another thing. So, so once you examine the patient, all the injuries and everything, you have to record it. And psychological support has to be given. Okay, psychiatrist, if you require psychological counseling, is very, very important for these patients. And once you examine the patient, again, the patient is called after 3 days also, because there are certain injury marks and bruises which are not seen immediately, but they can be visible after 3 days. So again, after 3 days, it is examined. And then after 3 weeks also, repeat pregnancy test has to be done. Of course, we are giving the emergency contraceptive and everything, but again, you have to repeat the pregnancy test. So now this SAFE kit, it is a booklet actually, which is given by the ministry. If you see, so this has all the documents in triplicate. 3 papers are there. So 1 paper goes to the police, 1 is given to the patient, and 1 is in the hospital record. So as you can see, I hope it is visible. So it is this booklet, it is a very good self-sufficient booklet. The person or doctor who is examining the patient for the first time also, okay, they can also do A to Z examination. Each and every step, it is actually incorporated in this. Then there are some 28 samples which are to be taken, and how to take the sample also it is mentioned very clearly, all the instruction for the doctor, consent, how you take the consent, and this is the chart, what I was talking about, the consent and then the first aid history and everything. And see, the pictures are there. You know, you have to do the examination top to bottom, and whatever injury marks are visible, you have to put it in the picture, anterior view, posterior view, everything. You can see these thing. And this is the back view. So you have to, it really takes time actually. Whenever we get any MLC case like this, it takes time, and you have to write each and every point has to be recorded. So this is the thing, all the aspects has to be covered. If there are any injuries, we have to see. Okay, this is the perineal area also we have to see. And then now this kit, actually it is a box. Okay, it contains all the material also. This is for age estimation. This paper, it shows age. If there's a doubt about the age, then age estimation, how to do is. So it is basically a box which contains all the items. It has a comb, scissors, you know, nail cutters, and everything is there, packets, everything. And around 28 samples which all has to be taken. So all the packets, all the items, and what all samples you have to take. And there's a perfect checklist also is there in this, so that you can keep on ticking. You can see here now this contents. So you just keep on ticking. You have taken this sample, this sample, this sample, so that nothing is missed in that that box, whatever is required from the safe kit. And if we have a problem, certainly we can ask the seniors also. They are available also. See, here you can see there are 28 samples which we have to take here. So once you have taken the sample, it has to be properly labeled. All the details has to be written, and this is then handed over to the police. Usually IO, they take the police and then they do the needful. So this, you can see the envelopes are there for the clothes also, inner clothes, outer clothes, everything has to be packed properly. These are the items. Okay, so these are all the things are there. So I just made a video so that we know we don't have to recall anything or nothing. Every the person who is doing the examination for the first time also can easily do. Of course, they will take time, but they will do definitely, and nothing gets missed. So this is a self-sufficient kit actually. So I stop here and then we'll move forward. Okay, so this is the kit which is developed, and we get a regular supply of this. So this is a safe kit we have to open when we get a sexual assault victim, consensual, non-consensual. Within 3 weeks, we use the safe kit. Now scenario 2 is, now you get a underage girl, less than 18 years. Now she has come with pregnancy, consensual or non-consensual. It is a crime. So now the protocols for MTP has to be followed. Now for MTP, the consent limit is more than 18 years. And for medical examination, it was for 12 years. So rape, yes, it is a rape. It is called a rape. So it has to be, the pregnancy, it has to be terminated. So again, same thing, we make the MLC, we call the police, we take the receiving, and IO is allotted, Child Welfare Committee, it is informed by the email or by the telephone, and we ensure that they have allotted an investigating officer. IO has been allotted, and we keep the phone number, everything with them. They bring a DNA kit also to collect the blood samples, and there is a photograph of the survivors, and everything has to be done. And then most important thing is that whenever we are terminating the pregnancy, POCs, product of conception, it has to be put in a container that has also should be arranged beforehand only. Whenever we do the termination, we tell them whenever they feel like passing urine or stools, use the bedpan, because they go in the toilet and then it get aborted. So then it becomes a problem because we have to retrieve the POCs. So we tell them to use the bedpan, and the container, it has to be rinsed with normal saline, and then we put the POCs in that, and then it has to be handed over to the police as early as possible because it has to go to the forensic lab. and the temperature has to be maintained, and ice box has to be used for that. This is for the DNA testing and identifying the accused. Now, consent again, MTP consent is more than 18 years if the girl is mentally fine. But here the minor who is less than 18 years, she cannot give the consent for MTP. But decision is hers. Let me make it very clear. There are the few instances we have found a girl, for example, she is 16 years and it was a consensual act, and she became pregnant and she wants to continue the pregnancy because it's a boyfriend and they want to marry or things like that. But the parents, they want her to abort the child. So what I want to say, this is a very nice book from the UNICEF 2021 handbook for support person actually, but each case scenarios they have explained very nicely. So if a girl want to continue the pregnancy, parents wants her to abort the pregnancy. So if there is a dispute, child welfare committee comes into play. The legal person is there, counsel the girl that pregnancy, if she carries all the pros and cons of the continuation of the pregnancy, and if she is okay, if she is ready to abort the child, it is fine. But still, if she is adamant that I have to continue the pregnancy, then no way parents can force her to do the MTP. Then the matter has to be taken to the court only. We cannot force her. See, parents are giving the consent only for the procedure MTP, but decision to terminate or not to terminate is actually girl's decision, and no one can force a girl to do the MTP, to get the MTP done. So if there are the disputes, we also got such disputes. So ultimately, we have to involve the court if a girl is not getting counseled and she is not ready to abort the child. So that is one thing. And suppose if we have girls who are living in some institution, they don't have parents or they're orphan or they're living in an institution. So in that, whoever is the head of the institution takes the decision. They will do the consent or everything, whatever legal thing is required. Now, same thing I have told you, if a minor girl refuses for MTP, so then child welfare committee actually plays a very important role. So we have to involve, by legally also, we have to involve the child welfare committee. Now, indication, now again, this is another aspect. If any minor comes with pregnancy, up to 20 weeks, easily we can terminate the pregnancy because humanitarian ground, rape. So we can terminate the pregnancy. If she comes up to 24 weeks, also we can terminate the pregnancy. Minor's pregnancy, we can terminate the pregnancy. But the problem occurs if a minor girl comes with the pregnancy and she is beyond 24 weeks. Because beyond 24 weeks, it is for the fetal malformation, we can do the MTP. So in such case, the court patient party, they have to file a writ petition, get the permission from the court, and then only the MTP can be done. Okay, and the places also, I will go into the detail again about how to go for the termination. Now place, again, minor, this is same as MTP Act. If a girl comes, okay, CSC, they can do the MTP till 12 weeks, medical college for any period of gestation, or any place, private hospital approved by district level committee. But as per the Act and current scenario, the approval is given only up to 24 weeks. Beyond 24 weeks, it is a government a medical college who have given the, they are entitled, or the tertiary, few designated tertiary care who are entitled for MTP, not all the place. So that we have to know. Now, this is the list of the medical board, and this is a list of the places where the MTP beyond 24 weeks can be done. So here you can see, these are the all government hospitals, and apart from that, private St. Stephen, Gangaram, Apollo, BLK, Max, they have also got the approval. I hope they have constituted. This was the order which was given, and they must have constituted the committee for the medical board. So medical board, I hope everybody know about the members of the medical board. So I will not go into the detail. So now this is a very important the court this thing which has come which was circulated to everybody. This is a Delhi High Court Legal Service Committee. Now this committee actually they have given the circular to each and every child welfare committee and all the government hospitals. We have got the notice. This is dated 2025, Now, why this came into act? Because there was a girl who was beyond 24 weeks, and she has approached to one medical college, and then they said, you are beyond 24 weeks, we cannot do anything. Go to the High Court, get your permission, and come. And then this girl and the family, they kept on moving from one place to other place, and then she was into the advanced pregnancy. So to avoid all these things, now what instructions has been given is that if any minor girl who comes with pregnancy beyond 24 weeks, whichever, so you suppose a private practitioner, you get such case, again you just inform the police, make the MLC, take the receiving, and you refer the patient to the medical college or the government hospital. So now for government people, what we have to do is we have to hold a medical board. This is in our hospital, we have the medical board for congenital anomalies beyond 24 weeks. We have already constituted. So we use same medical board and we take the decision that, and then the investigating officer takes that medical board decision and approach to the child welfare committee and the legal person. See, this order also mentions the name of the person and the telephone and mobile number. In case if this is changed, you can contact the office also. That is the DHCLSE. That is a Delhi High Court Legal Service Committee. So then this everything is free of cost. All the court permission, advocate work, everything is free of cost. So Child Welfare Committee takes into consideration everything. So they take the permission. Writ petition has to be filed by the High Court only. No lower court can take the decision. So now investigating officer take the order, whatever the medical board has decided. They have said, yes, we can go for the termination. So that order in the form D, they take to the court and then take the permission from the court, and then they come back. And then we do the MTP. I hope I'm clear with this point. If anything is lacking, you can ask me later. So these are the Child Welfare Committee. There's a list of all Child Welfare Committee. Whichever is near to your hospital, you have to involve them. So there are some. So this circular has reached. Now suppose a patient comes, you are in a government setup, patient has come to you on Saturday around 11 or 12 o'clock. Okay, and or maybe and then it is your responsibility to hold a virtual medical board also, because you have to take the decision as early as possible. Medical board has to take the decision, hand over the decision to IO, investigating officer, Child Welfare Committee, and then they take the permission from the court, so as to cut short the entire procedure. So virtual board also we can conduct if it is a half day or it is a holiday. So now this is very important. Now this is another aspect. Beyond 24 weeks pregnancy we are talking about. Now if a minor girl has a baby who is anomalous fetus, then there is no point. We can do the feticide before MTP. We can use the or end of life care. Feticide means intracardiac KCL also. It is now permitted. But if it is a child is normal, healthy child who is more than 24 weeks, so in that case, you have to take the consent prior to it. You have to counsel prior to it that the child may be born alive. So in that case, whether they are going to take the baby home or it has to be surrendered, or if they surrender, then it goes to the NGOs. So all those things has to be discussed carefully, and Child Welfare Committee, certainly they help a lot in dealing with such things. So everything has to be planned. See, beyond 24 weeks, you have done the medical board decision, you have given to the investigating officer. That officer takes it to the court, legal person takes it to the court, writ petition, court gives the permission, yes, go ahead for MTP, and then you do the MTP. But before that, you have to counsel about a baby who is going to be born alive, what you are going to do with that baby. Surrender it, or sometimes they take the baby also. There were the few instances. So everything you have to counsel and make a roadmap of it. So that is very important. This is just this is given in the WHO also. You can go through it. The dose intracardiac or intraamniotic, that is very easy. You just give the KCL and the heartbeat stops. This is for the anomalous baby I'm not talking about. Okay, then documentation. Again, consent form C has to be filled if you're doing the MTP. This is very important. Okay, we'll see. This is a consent form. guardian will give the consent for MTP. And if she's in, suppose she is staying in some, she is staying in any institution, then whoever is taking care of that girl will have to sign. No need for blood relative to give the consent. Anyone who is taking care of the girl can sign the consent form for MTP. Now, these are the forms. I hope everybody know about the MTP form, so I'm not going into the details. This is Form E. Now, this is the Form D I'm talking about, pregnancy beyond 24 weeks. Okay, so the decision has to be written here in the Form D. Form remains the same. The members who are involved in the board, and it has to be signed. And this Form D, IO takes it and goes for the petition along with the other legal paper. Now, this thing I want to highlight, if, see, MTP Act Section 5 says to save the life of a pregnant woman, suppose your center is not approved for MTP, okay, and if a patient comes, so you will have to take the necessary measure if that is endangering her life. So that situation also you have to keep in mind. You cannot say, no, our center is not registered and we don't have the qualified doctor. But whatever qualification, whatever infrastructure, whatever, do the needful, give the first aid or do the needful to the patient. Now, regarding the punishment, the previous speaker, Dr. Mandir, has already highlighted very nicely. So, rape of a girl less than 16 years means 10 years imprisonment and maximum of 20 years, that we have to know. And again, this is very important thing, failure of a citizen of India who is adult. If you don't report the child sexual abuse, imprisonment of 6 months. So this is what I am talking about. If any victim comes to you, make the MLC, take the receiving and keep that paper very safely, because after 2 years, 3 years, you may be called. So at least to save yourself, you have the paper that you have informed the police. So these are the few books where I have written all the step by step, whatever I have spoken and whatever I missed also. So thank you so much.